Nigeria.
Yes.
And it's good to know that we are here to actually witness it.
Yes, we are growing older, and talking about today is actually something that affects people older, So I think it's in line,
All right.
Yeah.
Thank you very much for joining us this morning. And this morning we're going to be discussing on breast cancer. And as we all know, this month is actually Breast Cancer Month. But yes, Dr. Toyin is going to be discussing with us all that we need to know with regards to breast cancer. But the phone lines will be open shortly for you to make your contributions on the program this morning. And starting off with what exactly breast cancer is, Dr. Toyin.
So, breast cancer is the cancer that forms in the cells of the breast. Very simple. Breast cancer can occur in women, and it rarely occurs in men. So both men and women can have breast cancer.
Oh, interesting.
Yes, not just women. And you see, it is the most common cancer in women all over the world, apart from skin cancer. Maybe the most skin cancer, because that's the one it's over to show that one is a lot. You just have breast cancer next, affecting women, and it is the leading cause of cancer death, in most places of the world. So it's very important, and that's why we've given a whole month in medicine to breast cancer, because we don't understand why, and we're trying to figure out why it's increasing. We want to help people know what they can do to prevent it, and if by any chance they find something like changing in their breast, what they can do quickly to prevent them from having this cancer that is ravaging the world.
All right. So I'm happy. You mentioned something on the fact that this is actually common in women. Yes, and there's men too are prone to this, but it's just that women are more prone to having breast cancer. And apparently, I'm not sure I've ever heard of any man having breast cancer. But why is there this difference that it is more about, or it happens more to women than men?
Yes, because if you look at the woman's breast and the male and the man's breast, they put them side by side, you see that one of them is bigger, isn't it? The woman's breast is bigger. It has more cells in it. I said this is a problem with the cells. It's producing something different. It's not behaving well. So that's cancer. It's becoming and overgrowing. It is not stopping in its division, and it is causing havoc. So if you have more cells in you, breast cells, you would have a more likely chance of getting cancer. A woman tends to have more breast tissue. And number two, hormones. They have a lot of hormones that have to regulate so many things, menstruation, their behavior. Hormones regulate a lot of things in women. So hormones have a role to play in breast cancer too. And we can even just go to the types of breast cancer. Breast cancer can affect every cell in the breast. And for the woman, there are many different types of cells, unlike the male zone. In the female, you have a cell that has to help you produce milk for your children. So that's the ductal cell. That one can have cancer. We have fat cells. We have lobular cells. We have so many types of cells in that structure, to make you feel differently, to make you do things differently, and to make you look good. Unlike that of the male, just majorly fat and some not too useful cells that are there. So there's less likely chance for them to get affected by the breast cancer. But yes, men do get breast cancer, especially males that have something we call gynecomastia. Gynecomastia means you're growing breast, something that can happen in a man and he starts growing bigger breast. And on fat men too, they will tend to have a bigger breast than slim men, so they are more likely to have breast cancer if they get. But it is very rare for a man to get breast cancer, but it is much more commoner in ladies, in women. That's why we emphasize women health when we're talking about breast cancer most of the time.
All right. Thank you very much, Dr. Toyin. 07000 917 917 is a studio line to call, and you can send in a WhatsApp or a text message to 070 070-317-56537. Yes, you can send us a text or a WhatsApp message this morning. But we would like to get to hear your questions. Dr. Toyin is here to be able to address whatever questions that you might have this morning. And on Women Radio, on Radio Doctor, we are discussing breast cancer this morning. Now, let's go to some of the symptoms. What are some of the symptoms of breast cancer? What are some of those things that you begin to feel in your body that should begin to give you concern or signs of you making sure you go to have a checkup or you go to start treating yourself for breast cancer?
Yeah, for most people, the most common symptom for most people is a lump.
Okay.
Of a lump in the breast or under your arm that does not go away. This is usually the first symptom most women feel. When the doctor sees you, he evaluates the lump and sees what is going on there by feeling it or doing a test we call a mammogram. But there are 5 other warning signs that a lot of people see that could say, oh man, I need to take care of this. I need to find out what's going on here. 5 other warning signs. The first one is a new lump in the breast. I mentioned that one, or under the arm. Number 2, a thickening or swelling of any part of the breast. So just say swelling somewhere, thickening somewhere. And usually in one breast. You know, when something happens, you have 2 breasts. When something happens in one and it's not in the other, it's very, very different from the other. You should be more wary. And when both of them are changing the same way,
okay,
that one is less likely to be cancer. But when it's happening in one breast and you see thickening or swelling there, you should get a doctor to look at that breast. Number 3 is an irritation or dimpling of the breast skin. You just see some rashes or irritation there. It's not going on. You see a part of it goes inside. Dimpling of the breast skin. Let us check it out.
Okay.
Number 4 is redness in the breast. So it's just red, especially around the nipple area of the breast. Not going, but it's just constantly red or flaky, you know. You should let us look at it. Number 4 is the pulling in of the nipple. You see the nipple goes in. It used to be pointed before. Now it's just going in. It's retracting. We call that retraction in medicine. You need to do something about it. Or finally, you have a nipple discharge. Nipple discharge. You know, it could be milky, but most of the time, if it is bloody, if the discharge is bloody, you should let us see you as soon as possible. That could be breast cancer. So these are the most common symptoms. So you see, like most of them are pointing to the breast. Something is changing. A change is happening in the breast. And these are usually early symptoms. And we can pick it early. It could help you save your life and even save your breast sometime.
All right. Thank you very much, Dr. Toyin, for that. 070-917-917 is a studio line to call to be a part of Radio Doctor this morning. And you can send in a WhatsApp or a text message to 070-317-56537. And we have been discussing on the issue of breast cancer. We would like to get your questions this morning. And Dr. Toyin has been able to enlighten us on what exactly breast cancer is, what are the types of breast cancers, and also the symptoms. So one should know when you need to get attention. Yes, doctor. I know that there is always the campaign, and there is always the caution for people to make sure that they go to the hospital for regular checkup. Now, for breast cancer, how often can one go to the hospital to examine, to go for examination to make sure the person is fine, so it doesn't go to the point that it's already probably at the late stage that there might not really be remedy before one goes to the hospital?
All right. So for breast cancer, what we preach is what we call breast examination, self-breast examination. So we should do that frequently, but we can do it especially for women above the age of 40. Once you hit 40, you need to examine your breast.
Okay.
Many times as possible. Know your breast, know how it feels, and know how it looks. And look at yourself in the mirror every morning. Try to feel your breast. And let your husband do it for you. It's going to help bonding. That's what we preach. We preach breast examination, what we call self-breast examination. But there are risk factors, risk factors that you say, oh, this person, risk factor is something that increases your chances of getting a disease, such as cancer. So if you have this thing in your body, there's a high likelihood that you might get the disease. So if you have some major risk factors, you don't have to wait to the age of 40 before you start having very regular breast examination.
Okay.
You need to even start that earlier in your life, and you need to do a test from the age of 40, which we call the mammogram. We call it the mammogram or breast ultrasound scan if you're less than 40 years old. Now, what are these risk factors? They are classified into two major groups. You have the risk factors that you can change. So it's called this one lifestyle-related breast cancer risk factors. If you stop doing some things today, you understand, you most likely not get breast cancer.
Okay.
That increases your likelihood of getting the disease.
Mm.
Then we have the ones that you cannot change. I will also tell you those ones. So because I do want to start with the ones you can change.
Yes, let's start with that so that people can get aware about that.
All right. So the ones you can change, the ones we call lifestyle-related breast cancer risk factors, include number one, the things you're taking into your body, like alcohol, drinking alcohol. If you take alcohol, it increases the risk of breast cancer, especially.
Hello, doctor. Hello. Oh, all right. So we'll try to get back to Dr. Toyin Olanrewaju. I think the network is actually acting funny this morning. But yes, you can send in your text message 070-317-56537 is the studio line to send in your text message to this morning. And you can call 070-917-917 and the doctor will be able to address whatever health challenge that you might have this morning. Yes, we'll try to get back to him. But this morning, we are discussing on breast cancer, and Dr. Toyin has been able to enlighten us on all that we need to know with regards to breast cancer. But please, if you have any question, you can call 070-917-917 and you can send in a text or a WhatsApp message to 070-317-56537. Those are the studio line to call and the text line for you to send your messages to this morning. He actually mentioned some things. First of all, defining what breast cancer is. He also mentioned the issue that has to do with the symptoms. And also, he started talking about some of those things that we should avoid so that we can be free from this. And the first thing he actually mentioned, the fact that those who do, smoking should actually try to reduce that. Welcome, Dr. Toyin.
Yes, so I'll tell you how to reduce our alcohol intake. We should also try to reduce our weight.
Okay.
And then we should try to become more physically active as much as we can. If you're more physically active, your chances of getting breast cancer, you're reducing it a lot. Now, there are some factors that are related to hormones. We believe that the more exposure or the less exposure you have to what we call estrogen in your lifetime reduces the risk of getting breast cancer. So if you have a lot of children, getting pregnant and you have children, you have more children, you have less exposure to this estrogen that I talk about, because when you're pregnant, you're not menstruating and all that. So this helps you to reduce your risk of breast cancer in a way directly related to hormones. So
but does that mean that we just keep giving birth?
No, but that means you should not have. What I'm trying to say is that you should have children. It's not that. At least try to have a child. You reduce your risk.
Oh, okay.
Just keep. Yeah. And let me tell you more about this. I actually noticed that women that do not have children, women that have had their first child after the age of 30 have a slightly higher breast cancer rate overall. This is research, you know. So having many pregnancies and becoming pregnant at an early age reduces your breast cancer risk. People have done researches and have proven that this is true. So try to have at least a child. So number two, breastfeeding. But it's a bit controversial too, because people will call me and say, does that mean my husband should be? No, breastfeeding is different from breast sucking. So
Okay.
if your children take your breast milk, if you breastfeed your children, and that's why we tell people to breastfeed for up to 2 years. If you do that, you're actually helping yourself to reduce the risk of cancer and also giving your children the right nutrients, which will help them grow strong and brilliant.
Okay.
You know. Then birth control. The more birth control you use, the more you're increasing your risk of breast cancer, especially the hormone-based ones.
Okay.
You know, we have oral contraceptives, and that's why we tell people that every day, you see, we call something emergency pill. You know, we tell you just take it once in a while, but people are taking emergency pill every time, having an emergency every time, and still not too. They're having emergency. You're supposed to have, because that's hormone you're taking into your body. I know why we call it emergency pill. When you make a mistake,
Okay.
so try to reduce that. And then lastly, we know people that take estrogen therapy. You know, some people, because they want to give back, they have a problem trying to give back. You have to pump them with estrogen. You have to doing IVF and all that. So the more cycles of IVF you go through, the more you're increasing your chances of breast cancer. So that is some of the things you can change. The last one is breast implants. So don't put things inside your breast. You know, people put one ring, one this, one that. Don't put things inside your breast. As much as you can avoid it, do not put things inside your breast. The way you are is beautiful. God created you well. So these are the things you can change. Now, the things you cannot change. Number one, you cannot change the fact that you're a woman. Can you change that one? Even if you remove things inside you, you're still a woman. So you cannot change that. And that is the number one thing that increases the risk of having breast cancer. You being a woman. A man has a less likelier chance of getting breast cancer. Number two, getting older. Hello?
Yes, I'm with you.
All right, sorry. Getting older. As we grow older, our risk of cancer, not just breast cancer, increases. You know, and then there's something about inheriting some genes. There are some genes that have been linked to breast cancer. We have the BRCA1, the BRCA2 gene. You know, if you have some of these genes inside your body, then there's a high likelier chance of getting breast cancer. So what you can do is to do a test, like what's her name? This famous actress, Angelina Jolie. She did a test. She saw she had the gene because her mom died of breast cancer, and she removed her breast. You get, so you don't really need to go that far, but if you have the gene, there's a high likelihood chance you can get breast cancer. And then if you already have some breast lesions before, there is a high likelihood that can happen or transform to breast cancer later. Then estrogen again.
Okay.
If you start your menstruation very early, and then you don't reach menopause on time. So if we say people that start menstruation before the age of 12, and people that go through menopause after the age of 55, they have a higher likelihood of getting breast cancer. So we've done a lot of research on breast cancer, but what I want you to take home the most is that we can solve this problem.
Okay.
Especially if you detect it early. And that's why we are preaching breast examination. That's why I say the commonest sign is a lump. Let a doctor feel an exact lump you find in your breast as soon as possible. If it is early. For more, you're hiding it. You don't want the male doctor to see your breast. Let the doctor evaluate that as much as possible. But you have to do the job of examining yourself first. So every day, much as at your breast and examine it. I think if we can do that, we'll save a lot of women well.
Thank you very much, Dr. Toyin. 0707917 is the studio line to call into Radio Doctor, your free health consultation program on Women Radio 91.7. Get your questions. 07031756537 is the studio line, and you can send a WhatsApp. You can call 0700917 Hello, good morning. Hello, good morning. All right, we can hear you there, but you can do what? Call us back 0700917 Now I have this text message here. This is from Grace. It says, can deodorant or roll-on cause breast enlargement, or roll-on or breast enlargement cream cause breast cancer?
Okay, cough. What cough is very big in medicine. What we saw is a different thing. Increase the chance of getting it. But the cause of breast cancer is not those things. I cannot say it's the cause. Is what? Is what? The cause of malaria is coming from mosquito. Called Plasmodium species. Yes, that's what causes malaria. But it's the cells that are just breathing. It's not we don't really know the true cause. You cannot say deodorant caused him, you doing this caused it, you doing that caused it. It's the cells that have mutated and have started growing anyhow. So I don't want to just tell her that even if I say it can increase the chances of you getting it, does not mean it is causing it.
Okay.
It just means the activity you would most likely not get. You can even still get it. That's the truth. You just increase some percentages. So what I will tell you to do is try to put anything foreign on your breast as much as you can. So if you're putting cream to enlarge, how can you put a cream and it will enlarge your breast? It's not the food that you eat inside your body that will make your breast enlarge. It is enlarging the cells, and it can lead to cancer. It can increase your risk of getting cancer. That's the word I want to use. So I will tell you that yes, creams that are actually trying to enlarge your breast from out, that's not medicine. You get.
Okay.
Most likely it's going to be a reaction. Don't know what's in that cream. Maybe they put some hormones, they put some stuff to stimulate something. As it stimulates that thing, it can mutate the cells and cause a problem. So as much as you can prevent and move away from that. Instead, you want your breast to become big, eat food, you add weight. But I tell you that even adding weight is a problem because it can estrogen stores and can increase your risk of breast cancer. Number two, she mentioned deodorant and the rest. It depends on what is there. Anything foreign around your body can actually increase your risk of you getting that, but it's not causing it. So try to go natural, try to go organic as much as you can. So they're taking something that your body would not react negatively to and to mutate and eventually form cancer. Small answer is it is not causing it, but it is increasing the risk of you getting it. If it is not natural.
All right. Thank you very much, Dr. Toyin, for giving that explanation this morning. And you're still listening to Radio Doctor, your free health consultation program where real doctors advise real people. And I still have over the phone with me this morning, I have Dr. Toyin Olanrewaju, and he has been helping us out with the topic breast cancer. But yes, because today is Independence Day, we actually have some gifts that we're going to be giving out, and this is courtesy Itunza Foods, Friends Land, Campaigner, Wacom, and also Chloe Foods and Confectionaries, Arabanla Ventures, and Modre Foods. And this is actually supported by, this giveaway is actually supported by these people. Itunza Foods, Friesland Campaigner Wamco, Chloe Foods and Confectionaries, and Arabanla Ventures, as well as Modre Foods, are actually going to be giving out these giveaways. But yes, this is going to be for women. So right now, I actually need women to call on this show rather. I'm actually going to select who is going to be the woman to be given this. And yes, I will let you know, and you'll be able to send your number to our text line so we can reach out to you on how you're going to get your gift. So this morning, I need women to call in on 07000 917 917. There is a giveaway this morning. And yes, you can send in a text or a WhatsApp message concerning the topic of discourse, which is breast cancer, to 070 317 565 37. Now, you actually mentioned the fact that there is a need to do mammogram as as oftentimes as you can do it, just to avoid breast cancer. And you actually gave it to us that people that are above 40 years are actually supposed to do this. But can you explain to us what a mammogram is like, what exactly it is?
Okay, mammogram is just a special X-ray of the breast tissue, the special one for the breast. And if you're not doing that often as you can, actually, because of exposure to radiation.
Oh, okay.
You're not advised to do it as often as you can. In fact, that's why we don't even do it in younger women.
Oh, all right.
You need to be above the age of 40 before we did. Number one, if you're younger, your breast tissue is denser. You get so we won't eat well if we do this test. And then number two, because of the exposure to radiation, we don't want young people to be exposed to radiation. We think older people. We love older people too, but it's younger people should do ultrasound scan.
Oh, okay. And that is why the examination, like the personal examination you can do for yourself, is there.
Yeah, that's what that's better. No radiation, nothing. We don't need to see and just feel it.
Okay.
We don't want it to be exposed. Now, mammogram, we just do an X-ray of the breast and we'll be able to see inside the breast tissue, and we tend to like people above the age of 40. Some people are saying we should go down to 35, but most countries choose 40. And the last thing about it is that it is not done as much as you want. You do it once every year. It depends on what they find the first time they do it. They can tell you to come next year. They can tell you to come some years after and just advise you. So you don't do it more than once a year most of the time. But if they find something that they can even tell you to do it another one few months time just to be sure of the diagnosis. Most of the time, after we've done the mammogram, we move to the next step. And that's to do what we call, if we find the tissue that is causing, that is looking different and looking problematic, we do what we call a biopsy of that breast. So we remove a part of the breast tissue, the breast lump that we've seen, and look at it under the microscope. Once we look at it under the microscope, we do some tests and we can say, okay, this is what is in the breast. If it is benign or it's not going to cause cancer, that's what I mean, or it is malignant or cancerous, then we can now continue with treatment or advise on the next course of action. So the biopsy usually follows the mammogram. We see something in the breast.
All right. Yeah. Thank you very much. 07000 917 917 is the studio line to call. Send a WhatsApp or a text message to 070 317 565 37. This text message is from Eniola, and she says, Dr. Toyin mentioned birth control pills and emergency pills increases ladies' chance of getting breast cancer. Now, she mentioned a particular brand of drug, and this has to do with the pills that you have to take. There's this pill for birth control that I have to take on a daily basis at a particular time that she mentioned. And she's like, does this actually increase one's chance to? Yes, Dr. Toyin.
I actually expected this question. And you see, in medicine, we are living in a world where you can't say 100% this is what causes. I told you about cancer. But for the pills, I know a lot of people on pills listening to me, and they're like, oh, doctor, you said that studies have found that women using oral contraceptive pills have a slightly higher risk of breast cancer than women who have never used them. See, once the pills are stopped, this risk seems to go back to normal within about 10 years. That's what the study says. Now, should I now take pills or not take pills? So what's the word I use? I said it slightly increases it, slightly. And we are now in between two things. If you don't have a family history of breast cancer, for example, nobody in your family had breast cancer, you don't have any, you're not obese, you don't take alcohol, I would say yes, you can take pills. But let me tell you that most people, before we place them on oral contraceptive pills, we ask questions. We found out that they don't have a family history of breast cancer. The family, they're not in the category of those people at high risk of getting breast cancer. So we can now add pills to their treatment or their medication so that they can prevent themselves from getting pregnant.
Okay.
That's what I'm trying to say. It depends on your non-modifiable risk factor. That's the one we cannot change. The family history, the genes that you have, what has happened to you. These are the counseling we do before we give you oral contraceptive pills. So that's why I tell people, don't just start using family planning. Go to the hospital. Definitely a doctor or a nurse will ask you several. We don't want to ask you those questions because we know that oral contraceptive pills can increase your chances of getting breast cancer. That's why we're asking you. And so we can choose and help you to make what we call an informed consent, to make you the informed choice, so that you don't choose the one that can affect you negatively.
Okay.
Don't just go jump on any contraceptive. Go to the hospital, we go through with you all the options, and then we choose the one that is best for you.
All
so,
right.
madam, if your other contraceptive pills gotten from the hospital, continue because they've already checked all these things. But if not, before you start, go and see the doctor, let him talk to you, and then the two of you start your process together.
All right. Thank you very much. And it's 19 minutes to 11 on Women Radio 91.7. You're still listening to Radio Doctor. 07000 917 917 is a studio line to call. Hello, good morning. Hello, good morning. All right, so we couldn't get to hear you there, but you can still call in 07000 917 917 and send a WhatsApp or a text message to 070 317 56537. Now, I have a text message here. It also says, good morning, doctor. This is Joy from K2. Please, what is the cause of continuous itching in the breast, and how often should one change their bra?
All right. Continuous itching in the breast. I told you that the breast is made up of so many cells. You let us start from the top. What do you see there? It's the skin. Isn't it? So the skin can have an infection, isn't it?
Okay.
You can have what we call a fungal infection. Fungal infection is notorious from itching. Eczema, apalapa, tetanus, we have so many fungal conditions, so many irritations that could occur on the breast, especially if your bra is dirty, because you mentioned that you can get an infection there and that will cause you itching. But very rarely breast cancer, but that's not a very classic symptom of breast cancer, but yes, it can. So if it's continuously itching, see a doctor too, and let them examine that breast, especially if it's just one of your breasts, and let's see what's connected. But most of the time, it's the skin, the fungal infection on the skin, right, irritated and causing you to itch. Now, for your bra, I would say you should change it. Just keep it clean. Wash it as often as you can. Wear a new bra every day. Don't make it dirty. And you don't need to change it. Changing not. I thought change means you need to buy a new one. What do you mean by change?
Okay, so I can't really tell there. Probably how often, how many times you should wear before you clean up or something. I don't know. But the basic thing is for it to be clean, and yes, make sure whatever it is you're wearing is clean. That is the most important thing.
That's the most important, yes. That's the most important. Yeah.
All right. Thank you very much, Doctor. 07000 917 917 is the studio line to call. Send in a WhatsApp or a text message to 070 317 56537. Hello, good morning.
Good morning. I'm sorry, calling from Ogba.
Okay, so I need you to turn down the volume of your radio.
Okay, I've done that.
Yes, what did you say your name is?
My name is Joyce from Ogba.
Joy, your radio is still on. I need you to turn it off completely so that I can hear you.
Okay. I'm listening now.
Yes, what is your question for the doctor? Yes, I can hear you.
If your breast, one is bigger than one, can it cause a breast cancer too?
All right. Thank you very much for that question. Yes, Dr. Toyin.
All right. So our breast, our testes, any structure in our body that comes in pairs, there's two. They are not the same. They are not equal. One is slightly bigger than the other. So if it's slightly bigger than the other, there is no problem. You are perfectly normal. So, madam, that's not a cause of breast cancer. It is just a normal differential in everybody. So do not be worried, not be alarmed.
All right. Thank you very much. Thank you so much, Doctor. 07000 917 is the studio line to call. Hello, good morning.
Hello, good morning.
Good morning.
This is Sahadat from Ikorodu, yes.
Sorry, I didn't get your name.
This is Sahadat from Ikorodu.
All right, Sahadat, it's good to have you.
Yes, please. I just want to ask Doctor this very question. I've been expressed like some little pain on my breast, up of my chest. But whenever I touch it, sometimes, maybe for a long time, if I just touch it, I'll feel that a little pain. But when I touch it everywhere, I didn't see any seed. I didn't see any of anything. But the pain will move away from there again. But maybe a long time ago again, when I touch it, I feel the same for the particular place. But when I started massaging it, trying to find out what is there, I won't feel the pain anymore. I just want to ask doctor, and I went to hospital, they checked it, they just told me that they didn't find anything there. So I don't know how is it.
Yes, Dr. Toyin, do you have any question for her?
So how old are you, madam?
How old are you? Oh, okay, she dropped the call.
All right. So she says she's feeling pain up her chest, around her breast area, and that pain is moving. It doesn't just stay in one spot. It goes from one place to another. And she's examined her breast, and they said everything is normal. I want to tell her that since your breast is normal, especially if you are younger, you should keep doing self-examination as frequently as you can. But not just your breast that is on your chest. You have other structures there. I mentioned the skin is there. We have the arm, it is your left side. We have the lungs. We have you have a lot of tissue, subcutaneous tissue. We have things that just go down that area. We even have nerves. So this could be from those other structures in your breast. Might not be exactly, your chest, sorry, not your breast. Might not be exactly from your breast tissue. So I would say you should just go and do a further evaluation of that area, and live an healthy lifestyle. Take good food, fruits, vegetable. Most of these things are not usually nerve issues. If you eat well, you exercise, you take care of yourself. Most of this pain that you say, I'm feeling this tingling sensation here, I'm feeling stuff here, is because of we are not living a healthy lifestyle. If you do that, you keep yourself healthy, exercise, things tend to normalize in our body. So that's what I would recommend for her. But she should keep an eye on that breast. If it continues, she might need to go further and do an ultrasound scan if she's younger, not just breast examination. And if she's above 40, she goes on to do the mammogram. And that will take care of her case.
All right. Thank you very much. Thank you for your contribution there, Dr. Toyin. Hello, good morning.
Hello, good morning.
Good morning. What's your name and where are you calling from?
Please call it from Uncle. Good morning, doctor.
Yes, good morning. What's your name?
Please, Kingsley, calling from Uncle.
All right, Kingsley, your question for the doctor.
I want to ask breast discharge. What causes it and what?
All right. Yes, Dr. Toyin, do you have any question for him?
Okay, so who is having the breast discharge? Is it a man or a woman? Is it a woman that is breastfeeding a child or a woman that is not breastfeeding a child. That's what's most important.
So who is having the breast discharge?
A woman, a lady, she's not breastfeeding a child.
Okay.
Very good. Okay, thank you.
All right, just want to listen over the radio. Yes, Dr. Toyin.
Okay, so some people suddenly start having some breast discharge, especially around time they are ovulating, some women, and we tend to relate this to hormones, some hormones. So when we notice a lady comes to us and says, "Oh, doctor, I'm not pregnant and I'm not breastfeeding, but I'm having a breast discharge," most of the time we want to check out the breast itself, sure that there's no cancer. We examine the breast, no cancer there, but I said breast cancer can lead to discharge, isn't it? So number two, we want to go further and check the hormonal status of this woman. There is an hormone that helps us to release breast or to release breast milk. It's called prolactin. If you have a lot of prolactin in your body, you are going to have breast discharge. So tend to say, okay, let's check your hormonal levels, and most of them is because of the prolactin. So what causes the prolactin levels to increase? Number one, it could be because of a problem called the prolactinoma. The prolactin is stimulated by a structure around our body, around our neck actually, that once it increases in size, it's going to make you produce that hormone a lot. So if you have that thing increasing in size, you have too much of prolactin in your body, you are going to have breast discharge, even when you're not supposed to have breast discharge. Number two could be that your hormone is changing, hormonal status is changing because of some things you're doing. Maybe you're ingesting something you're not supposed to take, you are stressing yourself, So we advise them to reduce stress, to watch out on what they're taking recently, so they can stop, and then sometimes it tends to normalize, and the extreme cases, if we cannot find a real cause, we give them something to reduce that breast discharge. We have medications that can stop you from discharging milk from your breast or whatever from your breast when it's not time for you to do that. And then we now give you an investigation. We now investigate you, and once we find the real cause, we now treat it. So for the tumor that we talked about, we remove it. Once we remove it, we stop it. If it's stress, we deal with it. If it is that you are actually getting, if you're pregnant and you don't know, solve that one too. So many things can cause it, but you need to see a doctor. So there are two major doctors that deal with this. We have the gynecologist and the endocrinologist. So don't worry, sir. You can tell this woman to see one of them, and they will take it further from where I've stopped.
Okay. At this point, we'll have to wrap up now. But treatment measures for breast cancer, I think it's important that we talk about this. So we can do this in 3 minutes.
All right. So breast cancer can be cured, especially if it is very early and you find the breast cancer. So that's why we wanted to examine. So it can be cured by some treatment, and the treatment that can really cure breast cancer, unfortunately, is surgery. We have to go and remove either a part of that breast that is cancerous, or the lump, especially for the one that we call DCIS, ductal cell invasive carcinoma. Once it's very early, we can just remove the lump and you'll be fine. But if it is becoming late, we now have to go further. Now we classify breast cancer into stages. We have stage 0 to stage 5. But stage 0 is the one we can cure. That one has not become so big. Just go there, remove the lumps, and then throw it away. We'll keep it. We'll do some tests on it and keep it. Now, the second stage, from stage 1 upwards to stage 5, the treatment is now varied. I will use 2 hours to tell you how we'll treat each of them. I will just classify it into 4 things that we can do. The first thing we can do is that we can cut off that breast. We can do a surgery to take off that part before it spreads.
Okay.
And that surgery usually is called I don't need to waste your time, but you can remove it. Number 2, we can burn that breast. We can do what we call a radiation therapy, radiotherapy. We can burn, that's burning of the site that is affected. Number 3, we can poison those cells that are growing anyhow in your breast. So
Okay.
we call that one chemotherapy. We are trying to poison those cells and stop them from growing anyhow. And then there are now new things we are now doing in different parts of the world. We have what we call immunotherapy. Work on your immune system to see how it can help you fight the problem. We have hormonal therapy. We have so many therapies, but they all come together to solve this problem. But we don't want to get to the stage where we have to use all of them. Once we just get to the stage where we just use one and you're okay. But you can only do that if you come to us early. And that's why we are appealing to people over there. That breast cancer, today is Independence Day. Breast cancer affects everybody. Yoruba, Hausa, Igbo. You know, it is something that has united us. This country that needs unity. Let us truly unite together and fight this scourge.
All right.
God will help us to have a great nation.
Thank you very much. Thank you so much, Dr. Toyin.
Yeah.
All right.
You're welcome. Bye.
And if you have to reach Dr. Toyin outside of the studio, you can call him on 0818 816 1105. 0818 816 1105. We have come to the end of Radio Doctor this morning. Thank you for sending in your message and thank you for calling in. But before we finally wrap up, there is going to be a webinar that is going to be taken live today by 2 p.m. on Women Radio 91.7. And this is the first annual Kwara Gender Equality Conference. And the theme of the conference is galvanizing the will to take action on gender equality and women empowerment. This is going to be today, 1st October 2020 by 2 p.m. It's going to be a virtual conference. And the host and the co-host, the host is His Excellency Governor of Kwara State, Abdulrahman Abdul Razak, and the co-host is Her Excellency, the First Lady, Dr. Mrs. Olufolake Abdul Razak. She is also going to be co-hosting this. There are going to be great women and men who are going to be contributing on this discussion. You don't want to miss any portion of this. We are already 60 years. We need to review what is the way forward for women. How have women fared when it has to do with inclusion? And that is very, very important. And now, considering that my giveaway, the person who has actually won my giveaway is Joy. She called in from Mogba. I'll need you to send in a text message with your name and your number. Your name and your number. Joy from Ogba. I need you to do that. Thank you very much for staying tuned to Women Radio 91.7. The text line that you drop your number to is 070 317 56537. 070-317-56537. Make sure you stay healthy and you have a lovely day.
To sponsor this program, please call 080-9058-2769.
Ijoma, I need some money to go to the hospital.
Tola, you still need money to go to the hospital? We're in the era of health insurance.
Health insurance?
Yes, you do know that illnesses never let you know when they're coming, but Ives Health Insurance offers financial cover in times like this.
Really? What am I waiting for? I'm off to get my Ives Health Insurance.
Trust me, Tola. Ives Medicare HMO Limited is competent, reliable, and they never joke with the health of their clients. They have different types of health plans for corporate bodies, communities, schools, hotel guests, travelers, individuals, and families. Ives Medicare is located at Hope Plaza, number 2, Osho Street, Okwebi, Ikeja, Lagos. For more information, please call 080-921-65592, 081-476-17220, and 080-326-39058.
Ives Med